Are you struggling to put your infant or toddler to sleep at night, only for them to wake up a couple of hours later for the whole cycle to begin again? Or have you got a teenager or adolescent in your house who simply likes to stay up all night browsing their mobile phone or playing video games? Or perhaps you have a school-going child who snores a lot at night and then they are sleepy throughout the day. If that is the case, please stay tuned with me till the end of this video, because today I am going to decode children's sleep problems. We are also going to demystify some myths and facts about sleep. Welcome to my channel, the 5-Minute Child Neurology Consult. My name is Dr. Pawan Kashyape, and I am a consultant pediatric neurologist with more than 15 years of training in this field. You can get more details about me by clicking on my LinkedIn profile in the description box below. In today's frantic world, many people struggle with a good night's sleep, which has been indeed proven scientifically to have numerous health benefits, including productivity, boosting immunity, memory, reducing inflammation, preventing chronic health conditions like hypertension and heart disease, and indeed increasing your longevity and quality of life. Let us first look at 5 important facts about sleep. Number 1, sleep is not just a static condition where the brain simply shuts off. In fact, it's a dynamic process where your brain undergoes various stages based on its electrical activity. In fact, there are 5 stages of sleep through which the brain cycles continuously throughout the night, each cycle lasting about 90 minutes. Number 2, a normal sleep usually includes 5 different stages. 4 stages of what is known as non-rapid eye movement or NREM sleep, also known as quiet sleep, and 1 stage of REM or rapid eye movement sleep. And the brain continuously cycles through these stages throughout the night. As the night progresses, the REM or rapid eye movement sleep becomes more in its duration compared to the NREM sleep. Number 3, the NREM sleep is also known as the slow wave sleep because the brain activity slows down during this stage. This is also the stage of sleep where the brain undergoes rest, repair, and flushing out toxins. Fact number 4, did you know that your memory gets consolidated during the NREM sleep, which means whatever information the brain receives during the daytime is stored in a temporary memory during the daytime in wakefulness, but it gets consolidated into blocks of memory during NREM sleep. This is unlike your computer, for example, where the memory gets instantly recorded into its hard drive. Now, people who have disrupted NREM sleep might hence struggle with memory. Fact number 5, talking about REM or rapid eye movement sleep. This is the stage of sleep where your brain is very active and also dreams a lot, and hence it is known as active sleep. There are also rapid eye movements back and forth, as if you are watching the dream. However, did you know that even though your brain is active during this stage, the rest of the body remains paralyzed, and this is Mother Nature's way to protect people from acting out their dreams. The duration of REM sleep increases towards early hours of morning just before one wakes up, and that is why people see most of their vivid dreams in the early hours before waking up. Okay, now let us look at 5 things that can go wrong with sleep in children and adolescents. Number 1, this is known as sleep onset association disorder. Now, to put it simply, it's an abnormal behavior pattern that is established in usually young infants and toddlers, wherein the toddler becomes dependent on meeting a certain condition in their environment to fall asleep. This could be in the form of a particular person or their favorite toy, or sucking on a pacifier, feeding from a bottle, or doing certain back and forth movements like rocking. Now, until this condition is met, the toddler will not fall asleep. What it also means is that even if they fall asleep and then wake up in the middle of the night, they will need this condition to be fulfilled before they can sleep again. This is obviously a recipe for problems in the middle of the night when the child wakes up. Number 2, obstructive sleep apnea. This is a condition where the tissues in the throat and nose partially obstruct the free passage of air at night, because at night your muscles of the neck are relaxed and hence the airway becomes naturally narrow. So anything that is obstructing it partially can cause problems with free passage of air. The common examples are tonsils and adenoids in young children, especially school-going kids who get recurrent throat infections, as well as children who are excessively obese or overweight, because that causes excess fat deposition in the tissues of the neck. One of the symptoms of obstructive sleep apnea is children snoring at night, almost most of the nights, and mouth breathing during the daytime. Number 3, parasomnias. Now, this is a medical term used to describe a group of conditions that occur unconsciously from sleep, usually from the NREM sleep at night, and affect younger children more than adults. Some examples include sleepwalking, sleep talking, grinding the teeth, and night terrors, in which the child wakes up screaming as if they have seen a bad dream. However, during these conditions, the children are not awake, you cannot interact with them, they usually pass within a few minutes, the child goes back to bed, and the next morning usually they have no recollection of what happened. Number 4, neurodevelopmental disorders. These include disorders like ADHD, autism, or chromosomal abnormalities with developmental problems. Usually these kids have disturbed sleep at night due to a combination of various factors, like a natural deficiency in the brain of the hormone called melatonin, which is one of the most important hormones helping us to sleep. At the same time, these children can have other medical conditions like gastric reflux or joint pain or muscle stiffness, which can cause disturbed sleep. Number 5, delayed sleep phase syndrome. Have you always thought that your teenager does not want to go to bed at a civilized time at night just because they're rebellious or they want to hang out on the social media? Well, that's not entirely true, because there is a physiological explanation for this behavior, and that is a natural shift of their biological clock, also called a circadian rhythm, towards later and later part of the day. This biological clock is partially controlled by a hormone called melatonin, which gives the brain and the body the signal to wind down and start sleep. However, if the release of this melatonin is delayed, then even if the teenager goes to bed, he will not easily fall asleep. And this can give rise to a vicious cycle where the teenager then engages in screen time, and this stimulates the eyes with the light. And this in turn suppresses the formation of melatonin. And thus, the teenager might stay awake most of the night and finally crash out in bed at early morning, obviously causing problems with rising up for their daily routine. Now let us look at 5 things in which you can help your child or adolescent achieve better sleep. Number 1, first let us talk about the process of transitioning children to sleep independently from their parents' room. Many times, if this process is not done in a proper way, abnormal behavior patterns can be established, leading to the sleep onset association disorder that I mentioned earlier. To avoid this, make sure that the process is done in a gradual way and not abruptly. Also, if you feel that your child is not ready yet, there is no harm in delaying it for a few more weeks or even months. At the same time, when you start the weaning process, make it gradual, which means try and sleep with your child for a couple of hours at least in their bed to start with, and then gradually wean it down by staying with them till they fall asleep, and then just promising them that you will check on them once in a while after they fall asleep. This will help your child to transition in a smooth way. You can also make use of particular objects or toys or a special blanket, for example, as your substitute, so that the children start relying more on that particular object, but make sure that it will be consistently available to them every night. Number 2, a consistent bedtime routine. it is very important to set a consistent routine which the child associates with going to sleep. This usually starts an hour or two before the scheduled bedtime and can involve some relaxing time like a warm bath, reading some stories, or playing soothing music. Make sure that all members of the family follow this routine consistently so that the child gets the same message from all of them. It is also important to make this routine into a fun time without causing a lot of friction or fight between the parent and the child, whereas at the same time you also need to set precise limits on what the child can and cannot demand during this time. For example, try and not give in to their demands to watch video games or do their homework just before sleep, as this will stimulate the brain and will prevent the release of the sleep-inducing hormone melatonin. Number 3, maintaining the correct room environment where the child sleeps. It is important that the room is dimly lit and not completely dark, as many children have a fear of the dark which might cause bedtime anxiety, preventing them from falling asleep. At the same time, the temperature of the room needs to be maintained in the proper range. Did you know that the correct recommended temperature for adults or adolescents is between 16 and 20 degrees, and for younger children it can be between 18 and 22 degrees Celsius. So make sure the thermostat in the room is accurate and set in the correct range, and this is something that can be easy to fix. Number 4. Now, if your infant or toddler has already developed the sleep onset association disorder in which they are highly dependent on meeting a certain condition before they can fall asleep, in that case, there are 2 ways in which you can tackle this. If you want more details about these 2 methods, then please click on the link below in the description and subscribe to the emailing list, and you will get your free downloadable copy. Number 5. Last but not the least, avoid preventable causes for sleep disruption at night, which include drinking caffeinated beverages after 3 or 4 p.m. in the afternoon, or taking long naps longer than an hour in the afternoon, or drinking a large amount of water just before going to bed. So make sure that your child drinks the required water intake after dinner, preferably 2 hours before their bedtime. Also encourage them to go to the loo and empty their bladder just before going to bed. Now let us look at 5 scenarios where you might need medical help when your child is struggling with sleep. Number 1, recurrent snoring at night, especially if also associated with mouth breathing during the daytime. This might entail enlarged tonsils and adenoids causing sleep apnea, and in that case you need to visit an ENT surgeon. Number 2, thrashing or violent movements in the bed during sleep, especially if associated with excess drooling of saliva or tongue bite or passing urine in the bed, could indicate a rare possibility of nocturnal seizures or epilepsy, which might need further investigations. Number 3, excess daytime sleepiness, even when the child seems to have had a good night's sleep, especially if this sleepiness occurs in unusual situations like at the dinner table or when an active class is going on, for example. This might indicate a rare underlying medical condition called narcolepsy, and again this needs to be medically investigated. Number 4, if your child has one of the neurodevelopmental disorders I discussed like ADHD or Down syndrome or autism spectrum, then they are naturally prone for disrupted sleep, which might be helped by prescription of certain medications like melatonin, but it is always a good idea to get a medical advice for this. And number 5, sleep disturbance that is caused by actual physical symptoms like somebody waking up from sleep with headaches or nausea and vomiting or abdominal pain or discomfort or acid reflux. These entail probable underlying medical condition that needs to be treated. There are also some children who rarely complain of a crawling sensation in both their legs or feet just before they fall asleep, and they need to pace around the room to release this sensation. This prevents them from initiating their sleep. This is a condition called restless legs syndrome, which might also need medical intervention. So if your child has any of these physical symptoms which either prevent them from falling asleep or wake them up in the middle of the night, then you should seek medical opinion. So friends, as we have seen today, there are a number of reasons why sleep can be disrupted in children as well as adolescents and beyond. However, many of these are easily fixable, as we have seen. So if you liked the tips given in this video, please like it, subscribe to my channel, and share it with your friends and families. Until next time, take care and stay well. Goodbye.